Hi, this is Dr. Matt over at Community Pet Healthcare, and I'm here today to talk to you a little bit about dental health and a dental cleaning procedure in pets. Here at Community Pet Healthcare, during your pet's dental cleaning, we have registered veterinary technicians or veterinary nurses who will be monitoring anesthesia and cleaning your dog's teeth. If there are any extractions or teeth that need to be pulled, then a veterinarian will be performing that procedure. Because dental procedures can produce some pain in our patients, there are multiple ways that we take care of and alleviate pain. Before a procedure, in the time when we are actually sedating a patient, the drugs that we use actually play a role in relieving pain ahead of time before we even cause any pain. During the procedure, we do use local anesthesia, medications that are delivered at the site of the tooth extraction to block the pain response in the body. And then following anesthesia, we will usually send home some type of medication, typically an anti-inflammatory drug, to alleviate pain that the pet might experience after the procedure. After a dental cleaning, a pet can potentially experience a number of mild side effects from the procedure, usually pertaining to the anesthesia that was used to help us perform the procedure. That could be anything from just being a little drowsy, a little mopey, they might not want to eat that night, and they might just want to be kind of left on their own. Sometimes, because of the fact that we do use endotracheal tubes to deliver the anesthesia, a patient might cough for a day or two after the procedure. If teeth are pulled, then they might experience some pain and some reluctance to eat, although we find that that's not a very common outcome from a dental extraction. Sometimes pets will have a little bit of a delay in their bowel movements for a few days after anesthesia too. That's totally normal. I like to tell people that what goes in must come out. As long as they're eating, then everything will be fine. What you feed your pet after a dental procedure will depend largely upon whether or not there were any tooth extractions. If there were none and it was a routine dental cleaning, then your pet can go back to eating their normal food that night, most likely. If there were tooth extractions, you will be guided by our staff in determining whether or not they should eat their normal food and if kibble should be fine, or if we would recommend that you soften the food or feed a canned food or something like that. Even with tooth extractions, oftentimes it is totally fine for a pet to eat the night of a procedure. Basic fundamental recommendation is that pet owners do something every day to prevent tartar in a pet's mouth. That could be toothbrushing, which is going to be your most effective, and other options would include dental treats, water additives, and dental diets. Whatever option you choose, it's best to check the Veterinary Oral Health Council's website at vohc.org to look at some of the options ahead of time and help you decide what's best for your pet.